going to discuss an important document recently developed by the OAS CCAT Demand Reduction Expert Group in collaboration with the Pan American Health Organization. This document brings important recommendations for the treatment of substance use disorders during the COVID-19 pandemic. I would like to welcome our speakers, starting with Ambassador Adam Nam, Executive Secretary of CCAT, Ms. Jimena Kalowski, our Demand Reduction Unit Chief, CCAT, and Ms. Esther Best, Director of the National Drug Council, Trinidad and Tobago. They will deliver the opening remarks today and introduce this webinar. Following our agenda, we will then welcome Dr. Jose Luis Vasquez, our treatment specialist here at the Demand Reduction team of CCAT, who will present and discuss this document with the recommendations by the expert groups. Finally, we will welcome our Executive Secretary for Multidimensional Security, Ms. Farah Rutia, who will deliver the closing remarks, followed by a Q&A session. Thank you for joining us here today, and I truly hope that you enjoy this webinar. I would like to invite now Ambassador Nam, our Executive Secretary of CCAT, to the floor. Ambassador Nam?
Thank you, Isabella, and good morning, everybody. It's a pleasure to be with you from Washington on a Friday. These are strange weeks, obviously, during the pandemic, but still nice to have a Friday, and I hope everybody out there, as Isabella said, is well, that your families, your colleagues are all well. These are unprecedented times in our lifetimes, and I hope everybody is doing as well as they can be. To respond to these unprecedented times, we have published the document, COVID-19 and the Treatment of Drug Use Disorders. And since the beginning of the COVID-19 pandemic, we've been working with OAS member states to face the new challenges brought on by the pandemic. The pandemic has unfortunately affected the implementation of treatment programs for people with problems of drug use. Because of the measures to control the pandemic, of course, many treatment programs have paused their operations, and others are unsure how to adapt to the new situation to continue to provide care without spreading COVID-19. Now, physical distancing and other actions taken to protect public health may affect continuity and access to treatment programs, that's for sure. People who use psychoactive substances and their families, though, continue to face challenges, and they have to adapt to the new reality posed by COVID-19, by the coronavirus. Healthcare providers, mainly frontline staff, also are facing unprecedented challenges due to the pandemic. I want to thank CCAD's Demand Reduction Experts Group, chaired by Colombia and vice-chaired by Paraguay, who, in coordination with the Pan American Health Organization, produced the recommendations that we are presenting today. The recommendations consider the value of community, the importance of feeling protected, the need for emotional support, and the need for a sense of hope and a need for a sense of peace. The document presented today is a contribution to the continuity of care for people in treatment, with full respect for their human rights and with high quality standards. And with those introductory remarks, I'd like to present Jimena Kalowski, who is the Chief of CCAD's Demand Reduction Unit, for her words. Thank you again for all of you for sharing this time with us. Jimena.
Thank you very much, Ambassador Nam. Good morning, everyone, and thank you very much for joining this webinar. I hope that all of you are well in this pandemic time. From the early days of the pandemic, the Demand Reduction Unit, with the chair and vice chair of the expert group, Colombia and Paraguay, began working on these recommendations that present today. We also have the valuable input of PAHO. We hope that this recommendation will be useful to you. Now, I leave with Esther Best, who will present to you and give us her openings remark. Thank you. Esther?
Good morning, everyone. And thank you so much, Jimena. Can everyone see and hear me? I hope so. Yeah? Good,
Yeah.
excellent. Thank you to CCAD for providing this opportunity for us to have this webinar this morning on this very important issue. I mean, we acknowledge that the situation with the coronavirus and COVID-19 is international. But for us in the Caribbean, of course, it represents a different kind of challenge because we are smaller societies with less resources to treat with these issues. So I really want to thank the Demand Reduction Expert Group and all of the other agencies who have contributed to putting this webinar together and to putting together the document that Jose Luis will take us through. You know, the Caribbean is a unique area. And one of the things that I was just on another webinar with some persons from Alcoholics Anonymous, and they were saying, well, you know, we are just that kind of culture. We just drink, we do what we do, and then we try to recover. And very early in our response to COVID-19, our bars were closed. But on the flip side of that, ironically, our liquor marts remained open. So that was a little bit of a disconnect there. However, we've all been subjected to stay-at-home orders. Some of the countries have had states of emergencies declared. And so there have been various experiences across the different islands. Some islands are still recording numbers of active cases, while others are not recording any new infections. In this area of specific to treatment and rehabilitation, for us here in Trinidad and Tobago, treatment was defined very early by our government as an essential service. So any agencies that were providing care in any environment were considered an essential service. So our treatment services continued. However, there were no new additions in those run by NGOs. However, in two of the government agencies, they took persons in only after they had been cleared for not having the coronavirus. There has been a strong focus on mental health in the handling of this issue, with this whole coronavirus issue, because of the recognition that having persons at home for extended periods of time will lend itself to some levels of challenges and also to possibly higher levels of substance use in the home. So this discussion and the recommendations that have been put forward in this document are very, very timely because it will take us now to continue managing where we are in this period of stay at home and lockdown, but it also has the opportunity to help us to plan forward as we return to some semblance of normalcy in our different countries. So again, let me thank CCAD for this initiative, thank the group of experts, PAHO, and all who have contributed to the content of the document. I hope that the participants will find it useful, will have many questions and seek clarification as we go through that would be relevant to their specific situations. So thank you again, and I really look forward to the discussion and the information that will be presented today. Thank you and God bless you.
Thank you, Esther. Jose Luis, you have the floor.
Thank you very much, Isabella. Good morning, everyone. Thanks for being today with us. It is an honor to present the document of recommendations produced by CCAD. So I'm going to start sharing with you the presentation today, and we will go through the recommendations. So thanks again, everyone, for being here today. These recommendations were produced by CCAD's expert group on demand reduction. As you know, the Americas and the world face an unprecedented global health emergency caused by COVID-19. Countries have implemented measures that include confining the population, for example, at home or in shelters for long and indefinite periods. The virus that causes COVID-19 attacks the lungs, so it can be especially dangerous to individuals who smoke or vape tobacco or marijuana. COVID-19 may pose a higher risk to people in vulnerable and socially disadvantaged conditions, like homeless populations, who have higher all-cause mortality. COVID-19 infection can increase this mortality disparity. On April 10, the Inter-American Commission on Human Rights adopted the resolution, Pandemic and Human Rights in the Americas, which states that the measures taken by countries to control COVID-19 pandemic must be entirely respectful of human rights. COVID-19 may seriously affect the full exercise of people's human rights because it imposes severe risks to life, health, and personal safety. The pandemic will impact societies, unfortunately, with emphasis on particularly vulnerable individuals and groups. To ensure protection and care for individuals currently in treatment for substance use disorders, as well as service providers working in treatment centers, the CCAT Experts Group on Demand Reduction, chaired by Colombia and vice-chaired by Paraguay, developed the document of recommendations presented today. There are three groups or three subgroups of recommendations. The recommendations for health services for people in treatment for problematic substance use is the largest group. On the screen, you can see a summarized version of the recommendations about resources for allocating more mental health resources to outpatient, community, and primary care services. Levels of care for reserving inpatient services for cases that require special attention due to life-threatening mental disorders, like people severely depressed and with suicide risk. Provide people with information and means to protect themselves. Here is important to consult the WHO document, Mental Health and Psychosocial Considerations during the COVID-19 outbreak. Provide essential hygiene resources to people in contact with health service providers. Encourage people not to gather, except in some cases, and highlighting the dangers to themselves and others in possibly contracting the disease. Anyone with respiratory symptoms or fever should stay home and contact health services quickly. Also, to continue with psychosocial therapies, it's important that if needed, you should consider contacting services consider providing contact remotely by telephone, internet, and other means with the necessary care and support. It's also important to ensure access to emergency care without discrimination, particularly because during this time, people with drug use disorders may be motivated to initiate or continue treatment to stop substance use. So it's crucial to be ready to provide support as soon as possible. It's important to restrict outpatient care and make the admission criteria stricter because of the risk of contagion and shorten the length of stay. Follow guidelines issued by national health systems for admitting new patients and for managing infected or exposed residents and visitors. Promote the continuity of treatment from home for this period until, using mainly remote services. And also don't forget services like telephone, SMS messages, and alternative means to internet. It's important also to maintain a medical team for patient referrals. Increase care for those in treatment and include families in daily contact. Maintain communications between members of therapy groups while always respecting the privacy of those participating. maintain interventions aimed at preventing stigma and discrimination, and please keep a record of telehealth interventions and the evolution of those who receive them. Also, it's important to foster work with families or support structures to develop a daily routine and identify resources of conflict and situations of violence within home. Strengthen strategies for relapse prevention. It's very important because this time also people would think or would feel a greater urgency of substance using. And you should also strengthen self-monitoring, planning, motivation, contingency management, and emotional management. If the user does not have a support network, institutions should provide or should be able to meet the needs of users and provide support. Also, it's important to provide up-to-date information about COVID and the drug treatment issues and monitor the medication under professional supervision. Consider individuals' physical and cognitive restrictions because all of the patients within the patients, there may be people with specific restrictions, physical and mental restrictions, particularly people with special considerations. And in that sense, also provide multimodal information materials tailored for people with audio or visual impairment, among others. Maintain an empathetic and understanding attitude to the demands of patients residing in treatment centers. Refer the person in treatment to the appropriate medical facility if you believe you are dealing with a suspected case of contagion. For people or teams working with homeless populations, it's also important to establish isolation and shelter facilities where they do not exist or they are not available. Establish public health strategies and support for those who refuse to go to shelters. Implement physical distancing in shelters and ensure enough supplies for cleaning and protection. Staff working with homeless populations should take every precaution to avoid infecting both the assisted community and themselves. It's important here to maintain an adequate distance and using personal protective equipment. The services should be designed taking into account the urgency of the situation and the needs of homeless population. Here we say that services must be adapted to people and not vice versa. Team care, the final subgroup of recommendations and maybe the most important because that's our core part of game players. We need to ensure dissemination and permanent updating of medical case management protocols, promote protective measures such as hand washing in working environments, maintain team monitoring, emphasizing self-care measures, just monitor constantly how is your team doing, how do they feel, which is their state, not only because of physical health, but also because of their mental health. And of course, you also want to monitor activities and ensure that they are getting enough rest, enough periods for resting. It's important to understand the conditions they are facing, both directly or indirectly, because they might be affected by COVID-19, and also their families might be affected. That's an important part because we also need to consider what's happening within that team care and the integrants, the persons in that team care. How are they dealing with this situation in their own homes? Establish a shift system for service providers. This is crucial because you already may face some shortening of staff. So this is important to manage adequately the shift system for being sure that you are offering as much care or as much services as possible. Reinforce personal protection recommendations to reduce the risk of contagion, provide mental health care options for workers, and warranty adequate conditions for professional teams by offering them space to rest and eat properly as a measure of self-care. Of course, we also need to offer and promote telemental health for them too, because the people in our teams of care would be also facing, or will be also facing, complicated situations because of what they are dealing with on a daily basis, constantly on their treatment centers. And maybe also many treatment centers may be converted or may be used now, or maybe needed for them to offer interventions to address specifically the COVID, which of course was not always or before something they usually do or did in the past. So that's the basic structure of the recommendations that we have developed here in the CICAD experts group for demand reduction. We thank you a lot for your attention. The document is already available online. You when we finish this webinar, you will find the link where you can download directly the document from our website in English, of course. Thanks again for your attention. And now we will be having a small time for some questions that you might have. Isabella, back to you. Thank you.
Thank you very much, Jose Luis, for this great presentation. We will now invite our Secretary for Multidimensional Security of the OES, Ms. Farah Urrutia. And after her presentation, we will go to the Q&A session. You will find that you can type in all your questions in the bottom. So just please feel free to start sending your questions, and then we will do it after our Secretary presents. Please, Secretary, go ahead. Welcome.
Thank you very much, Isabella. I hope you hear me clear. My name says Jose Luis Vasquez, but I am Farah Urrutia, but it's the technology. Hello, everyone. I am pleased to speak to you prior to the questions and comment period. I could not join you at the beginning because I was in another commitment. At the Organization of American States, and specifically within the Secretariat of Multidimensional Security, we have been mindful of countries' needs and proposing solutions tailored to address the new conditions under the COVID-19 pandemic. The Inter-American Drug Abuse Control Commission, CICAD, through its Demand Reduction Unit, is aware of how the pandemic is affecting treatment programs and care services in the Americas. The current COVID-19 pandemic is an unprecedented challenge that has several implications for care services. Measures to protect public health from COVID-19, such as quarantine and social distancing, will have a profound effect on pre-existing mental health conditions and disorders related to psychoactive substances use. From a holistic health perspective, it is necessary to recognize the relationship between mental health and the use of psychoactive substances. Positive mental health is fundamental for human development, allowing people to build relationships, construct meaningful life projects, and get through daily life activities, among many other issues. We hope that these recommendations will stimulate discussions and analysis of this new reality and effective ways of assisting countries to address the myriad of challenges in the area of treatment. I congratulate Colombia and Paraguay as chair and vice chair of the experts group, as well as PAHO, for collaborating on this initiative, and express the commitment of my secretariat to support our member states as we explore ways to address the drug problem during these unprecedented times. Thank you very much.
Thank you. Thank you very much, Secretary Urrutia, for joining us here and for delivering those remarks. We will now go ahead and move on to our questions. Please, just like I said before, please feel free to type in your questions, and Jose Luis will be answering them shortly. Jose Luis?
Thank you, Isabella. So on the bottom part of your screen for you as attendees or participants, on the bottom part of the screen, you should be seeing the option that says Q&A, or even the chat. So here we are getting some questions, particularly from an estimated friend, Natalia Carbon. Which online service is considered or has been identified as secure or close to such? I understand, Natalia, from your question, maybe that you were talking about providing telemental health or treatment through telehealth services. And let me tell you, there's no easy answer for the question you are asking. But of course, each of the systems have their own challenges. Maybe here's where we need to definitely go back to old school methods, where also you could think about telephone services, because having a telephonic conversation during these days may be something important that we would think about. So yep, there are many challenges for different systems. Of course, Zoom is one of them only one of them that you can use. There are many others from different providers. We're not here promoting any one in particular, but of course you need to be very careful of the privacy situations and the security situations, and discuss these directly with your institutional or with your institutions in your country, with the Ministry of Health, with drug commissions, with the representatives, official representatives in your country, to address in a better way the situation. Okay, so now in the Q&A, we have a question. Something about policy of testing for COVID. Well, here definitely we need to go back to countries, because countries are the ones who are going to decide which are the local policies that they are going to implement on terms regarding the testing for these or any other diseases, right? As we recommend here on we just said during the presentation, we recommend to follow very close the guidelines issued by your governments on these and any other situations. On the chat, we also have, I think it's also my friend, Dr. Persaud. Excellent contributions. I would be grateful for any recommendations or special considerations when providing counselor services via telephone for substance abuse issues. In Trinidad and Tobago, we are using our COVID-19 hotlines to also address psychosocial issues. Well, we also have something in the future that we will be sharing with you about some other issues of, telephonic services for addressing these needs. Fortunately, nowadays, many of your countries already have experienced a lot of years of experience with quit lines for helping people to stop using tobacco, right? So that's something basic, a basic infrastructure that you can take advantage of. And of course, you can start training your service providers in this different era, but of course you need to consider some other issues and elements for providing care by telephone or by telehealth services. And definitely we can work and discuss this later, Dr. Persaud and many others. We can definitely continue this conversation through the email and get into more details. So, Carlene Brathwaite, sorry if I pronounce wrong that name. Maybe Esther knows this person because it's from Trinidad and Tobago. How have you addressed the issue of digital poverty in serving vulnerable populations, including persons living with substance use disorders? Of course, digital technologies or internet means are limited in many of our countries, as you know. So this is a big challenge, of course. As I said, there are some alternatives that we should be using. We can always use telephone. We can always use SMS messages. We can use some other means trying to contact or to establish contact or continue contact with the population. But we don't have an easy answer to that. But we will be happy to collaborate with governments and drug commissions to develop any other alternatives and tools that may help people to face these challenges during these times. From Mexico, my friend, Nadia Robles. In Mexico, we have great challenges because the treatment centers are overcrowded. On the other hand, outpatient centers continue to work and offer services not only for the care of addiction, but also for mental health problems. Of course, yeah, there are many challenges in this way regarding this. And of course, also, if anyone else besides me from the panelists, I don't know if maybe Esther, Jimena would like to address any of these questions, I'll be, if any one of you wants to add anything to whatever I have commented, please feel free to do that. Okay, Elisa Rubini congratulates us. They are really great. I would love to see a follow-up with CICAT guidelines on the telehealth as we move forward as concrete tool to help and direct the countries in the implementation of treatment services in the COVID era. Okay, yeah, we will be working together, Elisa. We have a lot of work to do together, definitely. But I'm sure that we will be facing this. Okay, here we have Marta Vasquez. Congratulations for your presentation. I think the recommendations are excellent, but I understand our countries need financial resources. How our countries can get these resources? Yes, of course, this is an issue that all of us are, scrambling and trying to work. We work continuously to get more resources and funding. And of course, this is a big challenge for all of us worldwide, and the economic crisis that will follow this era, of course, is something that we need also to consider in providing services for people. Elizabeth Japal says hello. Thank you, Elizabeth, for being here. Tricia Deschong, great and straightforward recommendations. Thank you. Tiffany Barry, our good friend, very good friend, TV, for being here. Good morning. Do you have any specific recommendations on screening on new clients for admissions during this time? Yes, as you may remember, we said that we should be using or we should be performing the screening services in a more restricted way. Of course, observing the physical distance measures. We can always screen at a distance. Even in the real life, some days ago, I just visited some care service facilities, and they have a very well organized or streamlined process of, at the distance, you talk to a person, and even if you call them before, you can start coordinating your visit. And of course, this is something, some previous steps that you need to take into account or to considerate for having this. And if you review the full document, because what I presented was only, as I said, the summarized version. If you review a full document, you will get a more whole or complete view of what we recommend to do this. And of course, definitely strict or restrict your admission criteria, because you need people to be more, you don't want to be accepting lots of people in a very small space in that way. Okay, Nadia Robles, again, in these moments, the gaps for the attention of problems by substance use become more evident. Yes, thank you. Here also we have Little Jones Espeleta. Congratulations, thank you very much. Elizabeth Japal. Okay, very impressive list of recommendation. Yes, we all face challenges, Elizabeth, the limited resources, not only financial, but also our staff. We have a lot of limitations that we need to address, but hopefully if we work together, I'm sure that we will continue, we'll get good results at the end of the day. So, Fodai Jola, thank you. I'm sorry if I if I don't pronunciate well your name. Thank you for the presentation. The recommendations are very good, although some resource constrained countries will find some of them challenging. Definitely, we are aware of that, and we will continue working with you in alternative ways to address where these situations where the internet is not widely available, right? Robin Cuff. Hi, Robin. Not a question, just a comment. Technology solutions are great, but of course need to be viewed through privacy and health equity lenses, definitely. This is something that we'll need to continue to struggle with. For instance, during COVID-19, one of our large telecommunication companies provided smartphones with 3-month plans for clients of our drug treatment court who did not have any access to technology. It has made a huge difference. Robin is in Canada, so she's describing the situation in that country. And of course, we know that different countries face different challenges, and the realities of the Americas and worldwide countries have different realities. Gonzalo Sosa in Spanish. Good morning, Jose Luis. This is Gonzalo from Colombia. Amid this emergency, community organizations have been a big ally working with homeless populations, habitantes en situación de calle, and particularly addressing the substance use issues that they face. Have you thought about resources, technical and financial resources to support them? Yes, we are always developing trainings, and these webinars, for example, these sessions of webinars will be fully available for you. We will be specializing in some other topics like addressing this homeless population. I'm sure Jimena will come up with many good news about this because she has a lot of experience addressing this population, and we will put some materials together and we will make them available for countries to be aware of working with these populations. But my initial suggestion, Gonzalo, review the full document of recommendations, which is also available in Spanish, as you know. Ya sabes que el documento está en español, Gonzalo, también. Ahí vienen recomendaciones para ti. Pablo Figueroa, when do you think? Okay, Pablo, this is a different topic. I am not sure if I can answer your question here, but thanks for being here, and thanks for your words about my presentation. Robin Cuff, the telecommunications company, is getting a lot of good press because of this. Yes, you mentioned previously in your previous comment the telecommunications. That's good, Robin. Thank you. Rachel Mendy, great presentations and recommendations. Thought resource-constrained countries may find it hard. Marie Ernica Excesus Jourdain, congratulations for your presentation. We have many challenges in Haiti with a very young population who use alcohol, and that because of COVID, we fear seeing it consumption increase. So we will be definitely launching or hosting, better said, a webinar on alcohol soon. We already have programmed a webinar in alcohol about alcohol in Spanish with our colleagues from the Pan American Health Organization and some other entities from Spain. But also we will be in the future programming some webinars in English about alcohol. And I think, Oscar Alejandro, Alejandro Marin, Ministry of Health, Colombia. What has been thought from SICA to address the use of psychoactive substances after the pandemic? Yes, we are already working on that, Alejandro. It's good that you are writing from Colombia, which of course is the chair of our group, experts group. So definitely, if you get in touch with the Ministry of Justice, which is the Drug Commission, and our counterpart that we are working with within the experts group, we can discuss how to, through the group experts group, produce something on this regard. And your comment continues saying, and the challenges that this will imply in terms of the consequences that this will have on people and communities. Post COVID-19, what changes do you possibly foresee for the delivery of services moving forward? Okay, definitely. So, yeah, we have a lot of possible situations. We need to prepare for that, and we will be preparing for this within our working group, and also communicating with the other units of CICAD. And we will let you know soon. We will keep you posted on what we are planning to have as some other resources that will be available for this situation, because of course it's going to be complicated to go back to the new normality after this. Thank you, Tiffany. And that's it for today. I think we don't have anything. Oh, no, we have two more, but I'm not sure if we have any more time. Okay, we have one word here that says, Earl Longsword, morning rate recommendations, the only setback would be the limited resources in our country. I believe it's a matter of being more creative and still maintain a level of empathy in our service towards our clients. Carlene Brathwaite, how have you addressed the issue of digital poverty in survey? Yep, we already mentioned this. And good morning, Jose Luis. Are there any recommendations from Joella for the actual intake of clients into residential facilities? Well, yes, first of all, as we said, you should need to restrict your admission criteria, at least during this phase, during the first acute phase, because considering the possible harm or the harms to health because of COVID or the substance use disorders in comparison, you would need to first be sure that that person is safe at home, preferably not getting getting exposed to risk of contagion. And if you can start working with that person remotely, and then later evaluate the possibility of admission for further treatment, that's something that you could think about. Okay, so thank you very much for all and everyone being here. This has been a great opportunity for me. Of course, thank you very much for every one of the previous panelists. And I will give back the floor to Isabella Araujo. Thank you.
Thank you very much, Jose Luis, for this great presentation and also for addressing all of those very interesting questions. Thank you, each and every one of you who joined us here today and who presented your concerns and your questions and suggestions. We believe that this is a very important document, and we truly hope that this is very useful. Please make sure that you check out the full document, and if you have any questions, you can please feel free to reach out to us. We are planning a series of webinars in English, and we're hoping to specifically tailor to the needs of the Caribbean. So please stay tuned for the new topics that we're going to be addressing. Thank you for making the recommendations. We will be focusing on the main issues that the pandemic is creating for substance use in our countries. So also, if you have any questions and suggestions for the webinars, please feel free to let us know and we will take into consideration. We are also, for the next months and weeks, actually, we're thinking about doing dialogues with civil society as well. So this is also in our planning. And thank you again for your suggestions, for joining us here. This webinar will be available, the recordings, in case you want to share this with someone or maybe see it later. Thanks again. We appreciate you being here with us, and we see you again in the near future. Stay well and healthy. Thank you.